Well, let me paint some pictures for you. In Gujarat, India, Pramila, a 30-year-old mother of 2 boys, gave birth to a 3rd son and died in the ICU. The baby did not go home with her bereaved husband, but went home with Helen, a woman from the United States who had paid Pramila to carry her child. And just a few weeks earlier, 1,000 miles away in another part of India, another pregnant woman died. She died because she was beaten to force an abortion. And why? Because a local religious leader said that she would not have a son until her 7th pregnancy, and this was only her 6th. 2 females died that day, the woman, Muni, and her unborn daughter. In Rwanda, Christine gave birth and then was abandoned by her husband. Why? Well, her difficult labor caused an obstetric fistula, which left Christine incontinent, as she called herself, smelly and isolated, and her baby was stillborn. Let's come closer to home. In the US, women veterans describe traumatic experiences in VA hospitals and callous treatment of their military sexual trauma. A new kind of trauma that I hadn't heard before. And in the UK, there is, quote, a dearth of gender-based clinical research. And adolescent girls in India were the subjects of an HPV vaccine study without their consent, and 4 of them died. So the pattern that emerges is discrimination against women and girls in healthcare simply because they are female. Around the world, women and girls are objectified, commodified, and exploited. Commodification simply means that we view the human body or its parts in market terms. It treats the body as a commodity, as a source for meeting a personal need, such as for a kidney transplant to treat kidney failure, or eggs to create an embryo via IVF. But if our sensibilities are numbed to the way that women and girls are commodified around the world, then law professor Scott Altman suggests that we too have been commodified. Well, we resist commodification. That's why at the Center for Bioethics and Human Dignity, we have a focus on women and girls through our Global Women's Health Initiative. We are concerned with all the ways that bioethics intersects with women's dignity. That means that we pay attention to health, to discrimination and disparities in healthcare, to science and technology, and both reproductive and medical exploitation. So why is this important? And I'm going to argue that this is important because of the dignity of the person. This is a foundational teaching of Christianity from its earliest beginnings and its origins in the biblical account of God's creation of human beings. The Genesis account is quite clear. Humankind is made in the image of God. As image bearers, we show the signs of a good, a creative, and a compassionate God. Our status as image bearers is the source of our dignity. Whatever else it means, the status of image bearers and our dignity demands, requires that we treat all other image bearers with equal respect as people with dignity. Well, this understanding has transformed how people regard ourselves, how we regard each other, and how we regard the larger human community. To neglect the dignity of others is the path to decay and destruction, personally, communally, and nationally. As Dietrich von Hildebrand, a German philosopher, wrote, quote, all of Western Christian civilization stands and falls with the words of Genesis. God made man, and he means humankind, in his image. And respect for the human person is reinforced in Orthodox teaching. I heard an Orthodox bishop say that you're not a person unless someone loves you. I was startled, but he went on to say, but remember that if no one else loves you, God loves you. You are a person because you are loved by God. So every woman, no matter how sick, how poor, how lonely, or how abused, is a woman loved by God. She is a person with dignity. But even among Christians, we can identify situations and places where women are treated as unequal, that we are somehow created to serve the needs of others, or we are to blame for all the evil that exists in the world, or we're simply dismissed. This attitude is not consistent with the truth that all are equally image bearers of God. It reveals an inequality of respect. And that's something we want to change. Transforming communities one girl, one woman, one family, one church at a time. I'm going to discuss two alternative grounds for concern for women and girls. You will hear about human rights and social justice. And I'm going to briefly suggest how these concepts, while important, are incomplete or inadequate. First, human rights. Internationally, the human rights of women and girls are recognized through documents such as the United Nations Declaration of Human Rights. But let's go to a more recent example. The American Convention on Human Rights, also known as the San Jose Pact, which was affirmed in 1969, quote, "To consolidate in this hemisphere, within the framework of democratic institutions, a system of personal liberty and social justice based on respect for the essential rights of man." And in Article 4.1, it reads, "Every person has the right to have his life respected. This right shall be protected by law and in general from the moment of conception. No one shall be arbitrarily deprived of his life." Now, given that this was written in 1969, I think today it's safe to say that we understand man and his to include woman and hers. Well, last November, the Inter-American Court of Human Rights ruled that based on the trend of international regulations, they could not conclude that the embryo should be treated equally as a person or that it has a right to life. The unborn child was edited out of the goals of social justice and protections against being, quote, arbitrarily deprived of his life. And yet, these purposes were stated clearly in the goals of both the American Convention on Human Rights and Article 4. So a universal declaration or convention on human rights is written by people in power, and it can be changed by people in power. Our status as image bearers, our dignity is beyond the reach of any government, any international body, or any court. Well, this brings me to the second ground, social justice. It's a powerful phrase. But it's one that's also used as a convenient endorsement for the issue of the day. Today, it's sex trafficking and clean water. Yesterday, it was HIV/AIDS. All of these are social justice concerns, and they're worthy of our support. But social justice is so much more. Social justice includes issues that are not trendy or cool or even politically acceptable. Within the church, we have focused on abortion as a priority, and rightly so. But without diluting our concern for the violence of abortion against women, children, husbands, and families, we need to open our eyes to the almost nauseating variety of ways that women and girls are exploited and commodified, used and abused, neglected and ignored. Dr. Jamila George will dispel all doubts about the extent of the indignities. Among certain Christians, particularly those of a more conservative persuasion, there seems to be a bit of an allergic reaction to the phrase social justice, in part because it's perceived as carrying political or ideological assumptions that we don't share, and rightly so. And yet, Scripture is full of explicit references to care for the widow and the orphan, and explicit examples of concern for our physical bodies and healing. So let me suggest a different way of thinking about social justice. And I think it may help to see the richness and the deep theological support for this expectation of how we live together and seek the common good. I'm borrowing an idea from Margaret Farley, who wrote a small monograph entitled Compassionate Respect. Listen to that. Compassionate respect. Compassion evokes caring. Respect evokes justice. Compassionate caring and acting justly are essential aspects of Christian bioethics. Because focus on autonomy alone can lead to horrifying consequences. But focus on caring alone could lead to a soft paternalism. Compassionate respect harmonizes the demands of justice and the embodied concern of compassion. Compassionate caring means knowing the person in front of you, as she is in her particular situation. But it also means knowing what you can do. It means knowing your limitations and your abilities. Let's face it, we're all not little messiahs. Respect speaks to how we care. Respect, Justice means consideration not only of her immediate need, but of the circumstances of her life, those circumstances that contribute to her distress, those things that are unjust. Compassion and respect, love and justice, they go together. Theologian Miller Erickson puts it this way: God's justice is loving justice, and love is just love. So let me give you an example of compassionate respect in action, and that would be responses to the HIV/AIDS pandemic in Africa. Compassion requires that something must be done. Respect for the person, or just caring, demands that treating the disease not be severed from its causes. So our responses must address the connection between AIDS and sexual behavior, and the vulnerability of young women to being infected by older men, and the role that poverty plays, and the role of military conflict, and sex trafficking, and the moral leadership of churches, and so forth. Doesn't justice demand that we pay attention not only to people, but to the unjust circumstances of their lives? Respect also encompasses careful analysis. And where it's possible, we need credible research or evidence of the reality and extent of the injustice, and what is needed, and also what is effective in helping women. And we'll hear about some of that research at lunchtime. And the center is committed to credible research, to responsible science, to careful and rigorous analysis, and scholarly integrity. Now, let's give a recent example. Just this week, I received an advanced copy of a study done in Nairobi, Kenya. One of the major issues in Africa is maternal mortality, and one of the keys to reducing maternal mortality is giving birth in a hospital or clinic or other birthing center. In Kenya, about 6,500 women die every year, and, quote, unattended delivery is one of the greatest risk factors for maternal mortality and morbidity. So the government offered a voucher program that gave women access to a facility-based delivery. And these weren't free. They did have to purchase them for a small amount, but it gave them access to the medical care. Well, the findings of this study, while preliminary, and they were very careful in stating their findings, but they suggest a positive association between the use of vouchers and the facility-based deliveries. The use of the program varied among the different settlements, and they didn't know why that wasn't in the data, but they said there's a difference. We need to find out more about why some communities use these vouchers and others didn't. And they called them settlements. I suspect that may be what we sometimes refer to as the slums of Nairobi. And they pointed out the need for additional study. They didn't overstate the effectiveness of vouchers. There was a serious problem. People suggested solutions. And one way of implementing a solution, the voucher program, was tried and evaluated. As the study concluded, more research needs to be done to determine if the voucher program is cost-effective to use on a large scale. So credible research is an example of justice, of paying attention to the special circumstances of people's lives. Compassion amputated from justice can lead to exploitation. For example, compassion for your uncle with serious kidney disease who is at the bottom of the waiting list for a transplant could be an inducement to medical tourism. But justice would exclude sending him to India for a quicker, cheaper transplant and the purchase of a kidney on the black market. Compassion tells us what is needed. Respect or justice tells us how we must address that need. Well, what I say may not persuade you. As David Listman writes, people, quote, people do not acquire a sense of justice primarily on the basis of argument. Instead, they experience its contribution to their lives, close quote. Well, Her Dignity Network gives you the opportunity to experience the contribution of justice in your life as someone who extends compassionate respect and in the lives of those who receive it. Well, isn't this compassionate respect already being done? I mean, don't we have more than enough organizations and projects and government programs and advocates for issues of unjust treatment of women and girls? Why add one more competing voice to the mix? And it's a fair question. We've asked ourselves that. Well, as I alluded to earlier, this network is something different. First, the Center for Bioethics and Human Dignity is a Christian bioethics research center. That means we focus on issues of health, on the beginning and ending of human life, on medical research and human flourishing, and how science and technology affect our common humanity. Bioethics does intersect with issues such as sex trafficking, but it's distinct from that. Second, as I said earlier, the network is grounded in women's dignity as human dignity. This is not to deny the importance of human rights. Often, that's where the conversation begins, but as an abstract concept, human rights doesn't necessarily get at the fundamental basis of those rights. Because we understand that human beings are grounded in human dignity and our status as image bearers, we know that they are not granted by any human agency. Human rights are not dependent on physical or mental abilities, or cultural status, or where one happens to be born, or on age or condition of dependency. And third, we claim that human rights must be applied consistently throughout the entire lifespan, from conception through death. We are consistent. We don't carve out exceptions, such as for girls in the womb, and then wring our hands when it's almost exclusively girls that are aborted and unborn children who've been diagnosed with some kind of fetal defect. We are different than organizations that are concerned about reproductive trafficking in the Ukraine and India for the eggs and wombs of women, while at the same time supporting the rights of privileged women to use whatever technology they can afford, including surrogacy, to have a child. Amit Sengupta writes about medical tourism as a reverse subsidy for the elite and its impact on women's health. And I quote, "While women from across the world flock to India to take advantage of the booming market for assisted reproductive technologies, a very large number of Indian women are denied basic access to health care. Women are truly invisible to the public health system." End quote. Less than 20% have ever had any contact with any health worker. The network is different than other campaigns such as Million Moms because we ground our ethics in Christian theology and philosophy. Other organizations put women's rights and social justice front and center, but there's no mention of the woman as a spiritual being or that God has any relevance to her life. And some efforts focus solely on women's reproductive capacities, assuming that our primary concern is either to prevent or terminate a pregnancy. There are other issues where women are overlooked, such as clinical research bias and assumptions about the impact of medical treatments upon the female body. The network does not view women through the lens of radical autonomy as the basis of all our reproductive and other choices. We understand that no woman is truly independent, and that in most parts of the world, autonomy is not a driving cultural force. In fact, for most women, does not exist. She lives in relationships with others. She may have parents, a husband, children, brothers, a church family, friends in the village or down the block. But we also recognize that her problems do not exist in isolation. Many factors contribute to health and well-being, and when they are inferior or missing, people suffer. Compassionate respect pays attention to the circumstances. And although many of these are not the obvious concern of bioethics, it's important to be aware of them. They do affect health and longevity and the quality of life, and many affect both men and women. Let me just list a few. Clean water, safe drinking water, sanitation, nutrition throughout her lifetime, education and literacy, personal safety and security, unemployment, child marriage, poverty, child labor, violence, and war. So just what is Her Dignity Network? We are a global network of women and men united around the dignity of every woman and girl for her entire lifetime, from conception through death, mobilized to make a tangible difference through credible research, transformative education, and hands-on help, and motivated by the love of the one who made us all in his image and gave us dignity. The Hub is a website which will connect resources, individuals, and organizations around specific health issues faced by women and girls worldwide. Campaigns on specific issues will mobilize the support for on-the-ground care by identifying projects that align with the guiding principles. We'll highlight organizations that share the love of Christ. We'll disseminate best practices. We'll identify areas where more research is needed. and will give individuals like you and me concrete ways to get involved. Our guiding principles make it clear what we believe. And the first principle is this: we are motivated by the love of Christ. And we care about all of her health for all of her life. Are you ready to take action? Here's what you can do. You can join the network. You can support the network. You can invite others. You can follow our campaigns. And most importantly, you can pray for the network, for women and girls, our sisters around the world.